So I was thinking about how we would structure this interview, and I thought we can do it. I ask Dr. Shetty a question, he asked me a question. So let's start with the first. We'll go back in time to 1988, 1980, late 80s. You're a very successful cardiac surgeon in London. You're working in, at the time, the world's best center for doing cardiac surgery. You're doing the work that you love. You have a wife and 2 very young children. You get an offer to move back to take a job in Calcutta, a city you've never visited, a city you probably never heard of. You don't know anyone there, you don't speak the language, and you take the job. You say, I'll give all this up, I will go, move my young children away from London and put them in Calcutta and start all over again. The question is why?
Yes. Yeah, the answer is simple. When I went to England, I went there purely for training. Those days, cardiac surgery training wasn't to that level as it is today in India. So the only way I could learn the skill was to be working outside India, preferably in England. And that made all the difference. Of course, it was after finishing the training program, I had the option of settling down in England. But it never occurred to me that I should. I was actually looking at coming back to India maybe after 1 or 2 years, but your mother wasn't happy at all. My entire job was work very, very hard, collect some 300 pounds, and she will buy the ticket to go back to India or to US where her sister was there. So she was unhappy. The children were growing up. Obviously, I didn't want my children to be brought up in England. I delayed by 1 year because the cardiologist of Guy's Hospital, who offered me the job in B.M. Birla Heart Research Center, spelt the Birla family as Barla family. The Barla family is building a hospital in Calcutta. Would you like to go? I said, I don't know who these people are. I'm not interested. Then 1 year later, again Mr. Birla and his family came to England, and this time he spelt it as Birla family. Then I said, yes, I'm interested. So this is how the transformation happened, because and people from Bangalore will be very familiar. I tried to get a job in St. John's Medical College Hospital, and they refused to give me a job, saying you're too young to be a heart surgeon. But Birlas were very happy to give me a job because Mr. Birla's sister, Mrs. Ganga Somani, she looked at me and said, you look very young to be doing heart operation. And I said, no, I can do the operation, but how do I believe you? Then I said, okay, you come and see me operating. And she's perhaps the first woman or a person who employed a cardiac surgeon by visiting the Guy's Hospital operating room, watching me operating on 2 patients whole day in the operation theater. Then she said, yes, now you can do it, I'll offer you the job. This is how the story happened, and it couldn't have been better, because I believe that I have maybe some kind of a cosmic connection with West Bengal, and I believe that maybe in the past I was born there, yeah. It's been a very, very happy experience, transformation. Thanks. Oh, it's my turn to. Yeah, for all the entrepreneurs, if you are in a business, and in any business there is competition, you should do what others don't do. If you do what others are doing, maybe there is a 10%, 20% benefit, but you should do dramatically things different. Viren, in which way we are different than the other hospital groups?
I think as an organization, we always have gone against the grain. We do a lot of silly things, sometimes crazy things. And a lot of that comes from you, because you always encourage us to do things that are ridiculous and out of this world. But I think if you have to provide a more logical explanation for why we built our company in this mold where when every hospital in India at the time when we started was only treating very rich people and charging a lot of money for it, you said, no, I'll do huge numbers, I'll go for very low cost, I'll reduce the cost. So while it may have come from here for you, you would have thought that this is something that it's the right thing to do, this is what God put me on earth for. I think if you want to use the startup definition, they will call it expanding the TAM. TAM means total addressable market. So you see, the top 1% of the country, they can go to England and get treated, they can go to US and get treated, but what happens to the other 99%? So if you say, I want to build a business out of treating everybody else, you have to do things differently because the things that are already being done are not addressing it. So in everything that we've tried, running hospitals, opening up centers all over the place, getting into oncology, now doing insurance and building our own technology, I feel that the things that are already there have been done. It's not enough. This is India. We have the chance to innovate tremendously. So if no one else is going to do it, why not we be the ones to innovate?
Thanks. I'm glad I didn't attend any business school like you. Maybe I wouldn't have done what I did.
The next question I'll ask about what everyone here thinks about always is called fundraising. So we fast forward. We're now in the year 1999, 98, 99. You are starting up. It wasn't called startup, it was called starting up your own hospital. You're building it. And you have a team, you have a reputation, you have a track record, but no business history, no MBA, no pitch deck. There is no startup ecosystem. There are no venture capitalists wanting to back you. There's only banks. And for those, a lot of you, there was a time when the only sort of funding you got was debt. And debt funding in those days, it's not venture debt. This is personal guarantee, take your house away if you don't pay it back, that sort of debt. How do you go and convince these very stiff, buttoned up PSU bankers that you are a person worth backing to give money and you will build this only heart hospital in the edge of Bangalore and somehow people will come and get operated? How do you convince the people to give you money?
I think, Viren, I should go back to Calcutta because Calcutta started first. As Viren said, I had no capital, I had no experience of building a business, but I had a dream that Calcutta city needed a heart hospital. And it's very hard to get the money. Very fortunately, I was invited as a senior practicing doctor in Calcutta, you attend many functions and one dinner I was attending and there was one non-discreet person took me aside and he said, you are doing a lot of good job in this city and why don't you apply for a piece of land from the government and you can get the land. And when you meet somebody in a dinner party, people will, they want to be nice to you, especially you're a doctor. I thought he's one of those person. Then I said, yes, I will apply. Till then, I didn't even know that the government is a body which allots the land. That's the first time I came to know. This is about 36 years ago. A lot of you, I don't think, many of you are not born at that time. Yeah. So And I forgot about it. 2 weeks later, I had a call. Those days, there was no mobile phone. And somebody called me, and I was operating. They gave the call saying that CM's office want to talk to you. And I took the call, and he said, then the person said, this Chief Minister's Secretary speaking. I talked to you about the land. You didn't apply. I said, okay. Then I thought it's something serious. And in 2 weeks' time, they showed me 2-3 plots of land and got the land. I thought, the moment the land came, it shouldn't be difficult. But then I realized you need the capital. We tried a little bit here and there with the banks. We are not making much progress because, okay, I own the land and my wife gave me the money to pay. It's a very small amount of money we pay. Then many things happens, very interesting. At that time, the ICICI, the chairman of ICICI, Mr. KV Kamath, he's a friend, and I happened to meet him, and he was asking what's happening in Calcutta, and I said, I want to build a hospital. Then he said, okay, why don't you approach us, we'll help you. Then promptly his person came and talked to us, and they offered, they said they will help us with the money, but obviously they wanted some money to come from me, and obviously I didn't have that kind of a capital then. Similarly, Tata Finance was headed by Mr. Krishna Kumar, and he was a dear friend of mine, and he was casually talking about, you know, West Bengal needs one hospital, and why don't you build it? Then I said, yes, Mr. Krishna Kumar, I got the land, but there is no money. Then why don't you approach Tata Capital? I can speak to them. And I approached both parties, but all of them wanted some capital to come from somewhere. So then after a couple of months I realized, then I went back to ICICI and I told them that Tata Finance is investing, so you can also invest. They said, okay, if Tata Finance is investing, we will invest. Then I went to ICICI and told them that, so each one, now you must be thinking that, you know, what I said was true, right? But both of them knew that I was being honest and telling them a white lie. But the whole thing was they wanted to help me. They trusted me. It's all about the trust. So for any entrepreneur, the reputation is the most important factor for you to raise money or build your business or the right people to come. So if Mr. Kamath or Mr. Krishna Kumar didn't give me the money, I wouldn't have been able to start the hospital. Maybe I would have done it later, but not at that time. This is how this country is built. Yeah, this is the story of how big dreams start as a small dream. Thank you. Now it's my turn to ask you a question. Okay. Viren, about nearly 10 years ago, you came back from Stanford, and we spent huge sum of money in building the digital platform, but we were not reaching anywhere. One day you came and told me that, we are not reaching anywhere. We should start our own software subsidiary, which I opposed. And you fought tooth and nail. I didn't agree with you, but in the end, you went ahead and hired software engineers and started this venture without my consent. It was a big risk you have taken, but what gave you the confidence to go against your father and build a software company?
So, when I was in undergrad, I was doing engineering in one of the colleges in Bangalore, and there really wasn't much work I was doing there. So you would see me wasting time and you'll say, Bugger, you're wasting time. Come to the hospital, do some work. So I would go to the hospital, and because I wasn't a computer engineer, I wasn't biomedical, I'm not very useful inside the hospital, I did civil engineering. So they said, fine, go to the back of the hospital. There's one generator shed over there. There are a bunch of engineers like you are sitting. You go work with them, you learn how the hospital is built. Well, that's what I did. So I went back where the generator shed is. And that's where I started the working. When I was in college part-time, I would finish classes early, sometimes bunk and go to it. Was more, I learned a lot about how things work. But the one thing that I remember from those days was our hospital is in the absolute edge of town. And so power cut was frequent. And so then the power would go off, the UPS would come on, and there is this gap between when the UPS comes on and the generator come on. Those days we were very cheap. We had no money, so the generator didn't have the shield, and there was this thing called auto start, which was one really useless auto start mechanism. So whenever the power went, the lights will first go off in our office. And then everyone in that very tiny generator room office would be like this. And they would wait, because if the generator doesn't start, people will start dying in the hospital. So they'll wait, they'll count 5 seconds, that's as much, because the UPS also, you don't know when it will crank out. So if it doesn't, they'll go running like headless chickens, go to the generator, manually crank it, start it, do something. And I could see this again and again. Now, what that has to do with the software is that we were dependent on third-party providers, and you had insisted to this group that the software has to be cloud hosted. And the vendor we used was not competent enough to build something that could run on the cloud. And so it used to have outages. So what was happening in the generator shed, where an outage will happen and everyone runs around like headless chicken, was happening time and time again across our company. The software would go out, it would have an outage, the network would give some issue, doctors would not get their records, patients would start screaming, lines would build up. It was a ridiculous scenario. So then now what I didn't tell you, of course, was that the team had little more ambitious plans than that. They didn't just want to build software for your hospital, they wanted to build software for all the hospitals in the world. And what I initially told the board was that we would just do a temporary patch, turn out we did a full top to bottom rewrite, built the whole thing from scratch so it's scalable, it can grow. And so one of the big reasons for our success so far and why we are so far ahead digitally is because little white lies, so you don't always have to tell the truth, but it was driven from desperation, but I always had a sense that we could do something interesting.
I must thank you. Just to let you know that the software what they have built, we have nearly 200 software engineers. They have built something out of the world product. It is a joy using the software. The problem with the doctors is that doctors are not designed by God to type. So we need to create an application which is very intuitive. And also, if the software comes with the instruction manual, doctors will never read the manual and they will never learn. First thing they'll say is it doesn't work. So these are the problems of a software. So they created a fantastic software. So that made our life very, very comfortable. Thank you, Viren.
And he said, he looked at your palm, and he looked at whatever astrologers look at, and then he said, the people, you will go, you will do great things, and the people who will be around you will never leave you. And that's true. You have a fanatically loyal group of people who built the company into what it is. And they never left. This is the only job they've ever known. The surgeons who work with you have been 30, 40 years. Some of the administrators have been around for decades. So what are the lessons that you can share about how to build loyalty in a team, how to find people? What are the leadership qualities you need to look for in the people who you have to work with and face on a daily basis, whether in surgery or in all the other, in management?
It's very interesting. We have perhaps some of the most talented doctors who can earn maybe 3 times in working for other hospitals. But they choose to work with us. And we have people who are extremely competent and in non-medical areas, amazing people. They choose to work with us for decades and decades. It's not me. It is the purpose. We grossly underestimate the power of purpose. As a startup, when you start a venture, when 2-3 youngsters get together, they want to start something, the discussion is about what to do, which product or which service. Then the next question is how to do. But very rarely, startups ask why. Why to do? If the why question is answered in the beginning, if the purpose is explained in the beginning itself, and if the purpose is going to make life of millions of people better, believe me, cosmic forces will connive for your dream to come true. This is I will give you one example. You look at Mahatma Gandhi is always my hero. And he is not one of the greatest orators. He doesn't come from a royal family. He is not a tall, the imposing personality. How he could convince 400 million Indians to fight for the freedom and if required even sacrifice their life, and they didn't even know the meaning of freedom is because their parents were slaves, their grandparents were slaves, and he convinced them at a time forget about the internet, there was not even a newspaper. It is not him, it is the purpose. So when they join our organization as they work, they realize that no patient is turned away. And no patient undergoes a procedure which is not required. And there are many things what can be done to improve the business which we don't do. So this is the reason why very rarely doctors leave our organization. It's nothing to do with me, it is a purpose. Thank you. When I was, I think 17 years ago, I dreamt of a health insurance, which eventually became an insurance called Yashaswini, which was launched by the state of Karnataka. My dream was that if all the farmers pay 5 rupees per month, and if they should be covered to undergo any surgery if required, including heart operation. I mean, it was a crazy thing to think that with 5 rupees per month paid by a farmer, you can cover them for all types of operation, including heart operation. And somehow the government, at that time Chief Minister was Mr. S.M. Krishna, and I told him about this, and he got convinced. And it was discussed in their cabinet, and one of the cabinet minister was asking, 5 rupees, you can't get a packet of BD and you want to do heart operation. How is it possible? But we launched it, and 4.5 million farmers paid 5 rupees per month, and the insurance, and the government agreed to become the reinsurer, and the insurance ran for 12 years. And about 1.3 million farmers had varieties of surgeries, and nearly 1.5 lakh farmers had a cardiac procedure just by paying 5 rupees per month. And I thought in India, people do not have the money to pay for the health care. But I realized they have the money to pay for the health insurance if it is affordable. But I never thought that we as a company can become a health insurance company. Because my idea of health insurance can be done only by big multinational, big Indian conglomerates, not a hospital group like ours. Why were you convinced that that is a way to go forward and we should own a health insurance company? And once again, I didn't support you. Why were you so convinced that it has to be done?
See, one thing about working with Dr. Shetty, if he wants something, he'll never ask for it. He'll just say, this thing should be done. This thing must be done. This is the way, the future, this. So it means that, okay, he wants us to do it. He's just not saying those exact words, even though you specifically didn't say start an insurance company. I translated it to mean this is what you wanted. Now, why we should do insurance company? That we had zero confidence. We run hospitals. We used to run heart hospital. Then we got into running multi-specialty. People said you'll be useless at running multi-specialty, but we did it. We're not good at it, but then we keep getting better every year because we keep trying. Then we went outside India and people said you will not be good at it. And we were not good at it, but we kept at it and so we became good at it. So with insurance, we thought let's work with other people. So I visited the head offices of the other large insurance companies. I worked with them to try and understand, can we do a partnership? Can we work on this together? And I realized that these guys, one, this is the arrogance of me speaking, that they don't know what they're doing. But two, I realized that they will never be aligned with the way that we want to run health insurance. Then running the hospital, we know how difficult a time our patients have. They sold a policy, they think it covers 10 lakhs, actually doesn't cover anything. They have to pay so much out of pocket. They scream at us, they scream at the insurance company. It's not a happy situation. Then insurance itself. Not a lot of them tend to make a lot of money, even after charging so much. I'll ask you this. So every year, we have to take price increase to pay for the salary, to pay for all the price increases that go up. With great difficulty, we cut the cost, we do everything, but we have to increase the price for 5%. So since 2020, this was before the pandemic started, every year a price increase has been 5%. So that means till now, 20% has been the price increase for all our surgeries. How much do you think the insurance company premium has gone up? If you had to guess. 75%. For a 10 lakh rupee policy, the price has gone up 75%. And still they're not making money. And clearly these guys also don't know what they're doing. So the minute you told me that, my friend has become, and we know what makes them happy. And we know that an insurance plan that does not pay for everything does not make people happy. Everything else was just filling in the blanks. We had to change the structure, we had to make it a different kind, we had to look at managed care, we had to build clinics, we had to build software, we had to build a whole new team from scratch to build this. But essentially, this thing came because you kept saying this should be done, there has to be better insurance, there has to be a better system. So fine, if no one else is going to do it, we'll do it.
Thank you. I think I should add something why hospitals should become a health insurance company. It's a very interesting scenario of healthcare in India. There are three stakeholders in healthcare. There is hospital, there is health insurance company, and there is patient. Three stakeholders. Hospitals don't trust the health insurance company. Health insurance company doesn't trust the hospitals. And the patient doesn't trust both parties. And those two parties don't trust the patient. So we have three important stakeholders in this business who do not trust each other. So if the three stakeholders don't trust each other, that business cannot be scaled up. Now, what is the advantage of hospital become a health insurance company? Because alignment of the incentive, there is no conflict of interest between the patient and the doctor. I'll give you an example. Today, about 16% of the heart surgery done in India is done by our group across the country in all our hospitals. In reality, unfortunately, more people develop heart attack, it is better for my business. I have no incentive to prevent people from developing heart attack. And unfortunately, today when I sit in front of a patient and tell him that you need a bypass grafting, first thing what goes to the patient mind is it really required? or this man wants to make some money out of me. That is what goes to their mind. This is what goes to every patient's mind when a doctor says you need a procedure. But when I become a health insurance company and I tell a patient that you need a bypass grafting, there is no conflict because I am going to pay for it. And more than that, since I am a health insurance provider, we will work very, very hard to make sure that they don't develop the heart attack. They don't fall sick. So we will be working round the clock. We are going to do a preventive checkup. We know exactly what their profile is. A diabetic will ensure that diabetes is controlled. We will work very hard to make sure that they don't fall sick. Because if they remain well, we save money. If they fall sick, we lose money. Then my interest and the patient interest is aligned. There is no conflict. This is the beauty of hospital becoming a health insurance company.
Sure. A lot of people ask about work-life balance. I will never ask you that. You don't even understand the question. But the question is, after so many years, after all that you've achieved, after doing surgeries, and you still wake up very early, you go for work, you do your surgery, you see 80, 100 patients, you come home, you feed your grandkids, you take them out. How do you stay motivated to keep at the same company, the same role, and keep doing it well into your 7th decade?
Yeah, thank you. I want, especially the entrepreneurs, if you love your work, it stops being the work. It is not a work. It is a joy going for work. It is a joy working from morning till evening because you love what you are doing. So I am very lucky to be in a position to enjoy what I am doing. I don't look at it as a burden. I look at it as a place where I can relax. When I operate on the heart, I am the most relaxed person. For me, that's where I belong. That's what I want to do. As long as possible, as long as God allows me to do it. So in certain professions, there is no work-life balance. If people ask me what the work-life balance in my profession, I want to ask them a question. What is the work-life balance of a soldier in Siachen Glacier protecting our border so that we are all safe? What kind of a work-life balance he has? He chose to do this, and we chose to do this work. So we can't be really questioning about the work-life balance.
Dr. Shetty, my name is Mohammed Hussain. A few years before I heard you in one of such conferences, if any country is ruled directly by God, it is India. Can you please repeat that? Why was it said so?
Yeah. Thank you. You see, I just want to make a statement about what I feel about my country. I believe that India will become the first country in the world to dissociate healthcare from wealth. India will prove to the world that the wealth of the nation or wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. Now you may think that, yes, it is a very political statement he has made. It may take 50 years or 100 years to reach. No. It is going to happen within the next 5 to 10 years. The transformation in reaching out to the masses, mass healthcare, will happen in a very short period of time. Like, we are a very interesting nation. We have, if you really look at, mobile communication. Is there a separate mobile telephone network for the poor people and the rich people? The slum dwellers and the richest man living in a mansion has the same network. Is there any difference? Is there a TV channel only for the poor people or a TV channel only for the rich people? We have democratized entertainment. Similarly, healthcare will also reach out to everyone. The reason is, healthcare is not limited by any finite component. It is delivered by people, and we are blessed in having 1.3 billion people, and some of the outstanding doctors, nurses, technicians in the world, they're all Indians. So we are a privileged nation. Our only missing link is people do not have the money to pay for the healthcare. We believe health insurance will transform, and that will become an agent of making the working class people and the poor people to pay for the healthcare. And that transformation will happen very, very fast.
If both of you, like suppose your dates of birth were exchanged, means Dr. Devi Shetty was young as him and Viren was Dr. Devi Shetty, means you were born earlier and you were born later. What Viren would have, like Viren, I would like to ask you, what you would have done as Dr. Devi Shetty differently, and I would like to ask Dr. Devi Shetty that what you would have done differently, what Viren is not doing today.
While you would think that since I'm younger, that I would be the more risk-taking one, that's not the case. It's Dr. Shetty who's actually the more reckless of the two of us. So he always pushes us to the absolute edge of what we want to do, and my role is to pull us all back. So if I were in his position, I would have never been able to start this company, because simply that sort of maniacal focus and recklessness and that ability to create something out of nothing is not something that I would have been able to do, especially not in the late 90s, early 2000s. The environment was very different from what it is now. So I'm very glad that the situation exists now where startup founders who have really ridiculous ideas can come and get it seeded to, because who knows, it could work. But I would say that would be the big difference. If I had to start NH, it probably would have not been started.
I think, if I have to think back, the me as Viren now, maybe it's flattering. I would have done exactly what he has done as a son. I don't think I expect him to be anything different. Thanks.
Hello sir, great to hear you. I have two questions. One, you mentioned that obviously launching your own insurance is anti-business, right? And now you're a listed company. As an investor, it doesn't sound good as an investor per. Second question is on, you spoke about cosmic energy. So would love to hear, based on your rich experience of life, do you believe in luck? Some words on that, yeah.
Luck is a very, very important factor in our life. I will give you how it makes a difference. First thing is, all of us won the uterine lottery. Irrespective of how talented you are, if you are born in Afghanistan, what you could have done, doesn't matter how talented you are, it is very, very difficult. You could have been born in war-torn areas, any part of the world, but luck favored you and you were born in the right uterus. That is, we all won the uterine lottery. That is the first thing. Second thing, if I was born 500 years earlier, there is nothing I could have done. There was no entrepreneurship, there was no innovation, there was nothing. So, we were all born in the right country at the right time. So we should thank God for giving us that blessings. Thank you.
So that I can answer because I'm the one who always has to face the firing line of the investors. I think by now they are used to us. They know that our company is meant to be weird. They always understand that, okay, if you want a traditional money-making hospital business, there are other companies you invest in, but this is where things are just not quite right. Because they say they're only going to treat poor people, they're going to do things free, they're going to do insurance, they're going to do a bunch of unrelated things. So the investors generally tend to give us, either maybe they don't care enough, which is also its own sort of sadness, but I think they give us a lot of leeway and allow us to experiment. Now, we're not betting an incredible amount of money. We are so convinced that it'll work because when we got into this, despite how much we don't know about the business, the response we got from people who are interested in this plan has been phenomenal. With no marketing, with no spend on acquiring customers, no broker network. We don't have to do anything, and thousands of people call us every day and say, when are you launching, when are you launching? So in that, I would say that it's been a good response. But investors, yes, they know to expect. Sometimes, from time to time, we will do silly things.
Yeah. So my question is that there are a couple of health insurance company is planning to launch new schemes for the startups. So as you entered in the health insurance policy, are you planning to cover some sort of a health insurance for the startups?
Yes. In December, we will launch a plan. It won't be specifically for startups, but by startup, I think you mean people that work in Bangalore that are meant for cities that want that sort of coverage. Yes. But I'd say that the most important thing that will distinguish our policy from anyone else, we're not selling you a card with some paper on it. We are selling you the promise of health. And it's a promise that has to be kept on both sides. You promise that you will listen to us. You will get your preventive checkup done on time. You will take the medicine we prescribe you. You will get the recommended and prescribed amount of exercise. You make that promise to us as a company. And we promise that no matter what happens, no questions asked if you have our policy, no questions asked, you come to us, we will take care of you. So that's what we do.
In addition to your answer, there are startup policies which is coming out which covers the pre-existing disease also. So there are few companies only offer it, they call it a Jet Plus kind of a thing. Only the big corporates maybe who are maybe an employee of more than 2,000 employees, they cover the pre-existings. Mostly the startup face a problem of getting those benefits. Are you also thinking towards in that direction where the pre-existing disease will cover, where an employee will have 10 plus or maybe 15 plus, not 200 or 2,000?
That we're working out the terms and conditions. There will be some caveats attached, of course, but it doesn't mean it can't be managed. Anyone with a pre-existing condition doesn't mean tomorrow they'll die. It just means they need to be managed more intensively. So there's more testing. There's, again, much more of the promise needs to be maintained that we will put you on a rigid adherence and monitor you.
So I hope, this is the last question, given that this is the Startup Conclave. I'm Dhruti, and my question is to both of you. I want to ask you that, the healthcare ecosystem right now is booming with many startups who believe that they see promise in healthcare. So where do you see this sector, given that you've, gone through your own journey in terms of building what we would call a very respectable and a very attractive brand, something that has been respected immensely. So what do you believe? Are you going to look at working with more startups in terms of doing more proof of concepts? So where do you see this journey going forward?
We love to interact with startups who have brilliant ideas. And I strongly feel that the startups, if they have an interest in healthcare, they have to work with an established healthcare group. Because it's very easy for them to sit at home and think about how the healthcare should be and waste lots and lots of money and also their time and their talent. Whereas once they have a special interest in one particular aspect of health, we will be able to provide them the environment for them to, we have invested in few startups, we are working with many startups, we will be delighted as long as the interests are aligned. Yes. Thank you.
Just to add to that, Dr. Shetty is an accomplished drone pilot because the startup came to him with the drone. So he's not just simply saying we support startups. Dr. Shetty actually took the drone, learned to fly it, and flies every Sunday because he thinks that the drones can be used for medicine delivery. Then, one of the apps actually has listed Dr. Shetty as the patent holder for an algorithm that will be used for doing the clinical decision support. This is something that doctors use for being able to prescribe. And Dr. Shetty works as the product manager for one of the applications for the startup that we created. So the support that we talk about, this is...
And I think Dr. Devi Shetty deserves a standing ovation.